Okay, fantastic. Well, first of all, on behalf of Council and our new president, Robert Scheuer, and our acting chair, Michael Karangis, I'd like to welcome you, Tara, and Happy New Year to the college to present on what I think is mastery on the CPMF. We have had presentations in the past, but we have new council members and there's quite a turnover. So this is really great timing. And also to Douglas, just to welcome him. And I'm sure we'll have several questions for you at the end of your presentation.
Okay, Doug actually ended up having a conflict. So my colleague, Sarah Cabalia, is here with me as well.
Okay, thank you.
Well, first, Judy, thank you very much for the invitation and the opportunity to present to your new council. So as you said, today I'll present on some background and context that previous council members have likely heard and or seen before, given that we presented to your council, I believe last year, but it will be a good refresher and it will be an opportunity to provide sort of that background to your new council members. And so today I'll also provide council briefly with an update on the status of the CPMF in terms of implementation, as well as provide information going forward on what to expect over the upcoming year. So on the first slide, what I really want to do is sort of set the stage and talk about what is the CPMF. So moving on to slide 2. So the CPMF was developed to measure and report on the performance of Ontario's 26 health regulatory colleges. And this type of reporting will really be for the first time in Ontario. So the CPMF was developed by a working group, which I'll touch on later in the presentation. And the CPMF will provide aligned and standardized information across all of the colleges. It'll assess the degree to which colleges meet standards across 7 measurement domains that were identified as being critical in demonstrating regulatory excellence. So as you can see below, the 7 measurement domains are governance, resources, system partner, information management, regulatory policies, suitability to practice, and measuring and reporting on improvement. So I'll get into later on in the presentation a more in-depth information and more in-depth overview of what each of those, the types of information that each of those domains cover. So on the next slide, though, first I want to touch on why did we develop the CPMF? How did this project start? And so to do that, I'm going to rewind and bring us all back to 2018 when this project first began. And the development of the CPMF was really influenced by 4 main factors that were challenging the health regulatory system at that time. So first of all was accountability. So colleges, as you know, and as you approve each year, publicly publish an annual report that outlines the college's activities for the year. The challenge with that, in terms of measuring performance, is that within the annual report, colleges are only mandated to provide information or to provide an audited financial statement. So that's the only mandated requirement for colleges. And so when the ministry undertook a review of colleges' annual reports, we noted that there were 760 different indicators or types of information that colleges were reporting on in their annual report. And of those 760, 425 of them were unique. So when I say unique, I mean only reported by one college. And so there was quite a lot of inconsistency and variability in the type of information that colleges were reporting. And that was between colleges, but also within colleges. So year to year, the information that each college itself published in its annual report. And this made it difficult to use this information to assess performance in a standardized way. One of the other factors that we were looking at was public trust. So I'm sure you're aware, during 2018, there was public and societal concern about how regulators were overseeing their professions. And this was portrayed through various media channels. And the growing public perception or concern was that, were colleges acting in the public interest as they were mandated, or were they really acting in the professional interests? Was this sort of, a members club, or were they really there to protect and serve? And underlying, these accountability and public trust challenges was the fact that performance measurement itself was a growing international trend. I'm sure you'll remember the work that started in the UK and in Australia, and they started measuring not only health, but also non-health regulators to determine how well are they performing. During this time, there were also recent public reports that highlighted challenges in Ontario's health regulatory system, such as the Sexual Abuse Task Force report, as well as the McMaster Citizens Panel. And so this brought pause and, at the ministry made us consider, how do we know how colleges are performing and if they're meeting their mandate? How do we know if colleges are performing well in the public interest and serving and protecting the public? And how will we recognize regulatory excellence when we see it? How will we be able to say this college is demonstrating regulatory excellence? And on top of the performance aspect, there was also a growing trend at the same time and quite a revolution in terms of in other countries and across the world, how regulatory oversight of healthcare professionals was being undertaken. So what was the approach? And self-regulation started to change in terms of the way it looked in other countries. And these changes were quite significant in some circumstances. And in Ontario, we looked at the CPMF as a way to provide us information on how well our system was working, how was self-regulation performing in Ontario. And this information would help inform any type of modernization considerations within Ontario. So moving on to the next slide, I want to look at what is the intent, what is the goal of the CPMF? How will it address these challenges, these four main factors that were challenging the health regulatory system? And so the CPMF is intended to strengthen the accountability of each of the health regulatory colleges, as well as support the ministry's commitment to building a connected and sustainable healthcare system that's centered around the needs of patients. So the CPMF is the Health Workforce Regulatory Oversight's branch contribution to that overarching ministry goal. And we see this happening by the strengthening of the accountability through providing information that is transparent, consistent, and aligned across all 26 health regulatory colleges, provides reporting on performance of these colleges in a standardized manner, and importantly, that allows colleges to identify benchmarks and best practices that allows them to proactively implement approaches to support improvement activities. So the CPMF, as I mentioned, was developed in collaboration with a working group. And so this working group consisted of experts in performance measurement, quality improvement, and also public reporting. There was representatives from the public on the working group, as well as a representative sample from the health regulatory colleges themselves. So registrars from colleges that were larger in size, smaller in size, oversaw professionals that provided direct patient care, as well as those that oversaw professionals that did not provide direct patient care. They were all included on the working group. And the working group worked with the ministry in identifying the domains, the standards, the measures, refining and validating all of the information that was included in the CPMF. And so on the next slide, I want to get into providing a little bit of information about, what are the components of the CPMF? How is it laid out? How is it made up? And so what you'll see is there's 6 components, or sort of 6 layers of the CPMF. And we'll go from sort of those general, broader areas to sort of the more granular information that the CPMF will require colleges to report on. So first is the measurement domains. The measurement domains are really the broad categories or general areas of focus that were identified as being critical and required to demonstrate regulatory excellence. So those were the domains on the previous slide, such as governance, suitability to practice. Those are the domains. The standards fall underneath the domains and provide more detailed information on how the colleges would be expected to identify regulatory excellence under each of the domains. So what are the best practices that colleges would engage in to meet or demonstrate regulatory excellence within each of those domains. And then the measures provide further guidance to each college on how would you demonstrate that you meet a standard within the domain. And then getting sort of down to the minutia, or the granular pieces, is the evidence. So this is what each college is being asked to report on to demonstrate that they meet the measures, and then that rolls up to the standards and domains. So the college has taken the approach to, at least in the first iteration, to say, this is what we want you to tell us to demonstrate that you meet the measures under each of the standards. So next is the contextual information. So the contextual information is different than the information provided through the evidence. So the evidence provided within the main part of the framework under each of the domains is more qualitative in nature. It's asking for the colleges to provide a description of the activities or processes that they undertake. The contextual information is statistical or quantitative data that the colleges are asked to provide. And it's important to note that these are not intended to be directional. These are non-directional pieces of data that provide additional context with respect to specific standards. And so all of the contextual measures do link back to standards or measures within the CPMF. And the reason I say that they're not intended to be directional is, at this point in time, we don't necessarily have benchmarks in regulation to say, if you receive a lot of complaints, is that good or is that bad? Does that mean there's challenges in overseeing the profession? Or does that mean that the public is very well informed of the college's role and knows to bring any concerns to the college? And so by, at this point in time, setting benchmarks or goals, or commenting on whether a contextual information specific number reported is good or bad, we note that there could be unintended consequences. So at this time, the contextual information of the statistical data is not meant to be assessed in terms of you're doing well, you're doing poorly. It really just provides more context and information to be able to see the full picture of the standards and measures. And lastly, you'll see the planned improvement activities. And so this is where, whether you as a college note that you meet a standard or that you partially meet and you're working towards it, the planned improvement actions provide colleges the opportunity to report on what they commit to implementing, or the actions that they commit that they are going to undertake. And the idea is that colleges in subsequent years would report back on those commitments that they made and provide a progress report or an update on how they're doing. So next, I want to sort of move down another level, and I want to provide an overview of, what are these domains? What is measured within each domain? And so within the governance domain, what we're really looking at is, how do colleges ensure that they have people on their council with the knowledge and skills needed to support and strategically guide the college? How does the college demonstrate and ensure that its decisions are made in the public interest? And how does the college transparently communicate its decisions, its decision-making processes, decisions it will be making, and the actions it's taking in a way that is really publicly consumable? Under the resources domain, this is looking at the fact that colleges need to ensure that they have both financial and human resource stability to ensure that they can continue both now and in the future to support their operations and meet their public interest mandate. Under the system partner domain, this is looking at colleges to report and demonstrate, how do you collaborate not just with one another within the regulatory system, but how do colleges connect and collaborate with the broader healthcare system? I mean, as you know, the professionals that you oversee provide care to all Ontarians and across all settings within the healthcare system. So how do you show that as a college, you ensure that you collaborate with system partners that are both within the health regulatory world and in the larger context within the healthcare system? The fourth domain looks at information management. So colleges hold a lot of information and collect and gain a lot of information in the course of doing their business. So how do colleges ensure that this information that it holds is securely retained and that it is used for the purpose that it was collected? Domain 5 addresses regulatory policies. So how does the college ensure that the guidance that it provides to the membership reflects available evidence, best practices, is aligned with changes in public expectations, and is aligned amongst the colleges? So for example, where there's overlap in the type of practice and scope of practice that the profession that the colleges oversee has with other professions or other areas. Domain 6 looks at suitability to practice. So what this is really looking at is those operations within the college that support the college in being able to ensure that individuals that come in to practice are qualified, skilled, and competent, and that during the ongoing course of a member's practice, that they remain competent, safe, and ethical. And so this looks at operations such as ICRC and discipline, as well as quality assurance. The last domain is around measurement, reporting, and improvement. So how does the college demonstrate it, that it, as an organization, continually assesses risks and that it measures, evaluates, and improves its performance year on year? And how does the college transparently report this information, so about both its performance and improvement activities, to the public? So now that I've provided some of that background and context, I want to give you an update on the status and the key timelines for the CPMF moving forward. So as I'm sure you're all aware, the ministry formally launched the CPMF on December 1st. And this is when the colleges were provided with the CPMF reporting tool that colleges will be asked to complete annually, as well as a technical specifications document that outlines the methodology for completing the contextual information. And again, that goes to supporting standardized reporting across all colleges, so that when we ask for a piece of data or a piece of information to be reported in a quantitative manner, that all colleges are calculating that data in the same way. And then finally, a consolidated frequently asked questions document was provided. And so what this captured was any questions the ministry had received during the development and the initial consultation period with respect to the CPMF, so that all colleges had the same information and responses about the CPMF, how it will be reported, etc. And so a lot of those FAQs were gathered during the soft launch. So in September, the ministry released a final draft of the CPMF and asked colleges to engage with us to let us know if there was anything that was unclear or whether they had any questions with respect to any of the standards, measures, or evidence that they were being asked to report on. So following those discussions, the CPMF was formally launched, as I noted, on December 1st, 2020 to colleges. And so the next step in this process is colleges will all be asked to post their completed CPMF reports on their website by March 31st, 2021, and to either provide a copy of the report or let the ministry know that the report is posted by that time. And so once these reports are posted, the ministry, in collaboration with a working group, very, very similar to the working group from the initial processes of the project, will identify best practices or general challenges in the health regulatory system. And the ministry will draft and post a summary report on the college's performance and improvement activities. And so what the summary report will look at, as I said, is general, the best practices that have been identified by colleges in their reporting tools or in their reports, as well as it'll be very high level and take a systematic view of how well in general is the health regulatory system doing. Are there areas for general improvement across the system? Are there challenges across the general system? Following receiving the college reports, as well as drafting the summary report, the working group and the ministry will evaluate and refine the standards, measures, and evidence. And so we have committed as a ministry that this report, or the CPMF itself, will be iterative, and year over year we will look to make sure that the evidence we're collecting is still relevant, still needed, still useful. So this will not be a static project. It'll reflect not only the information we receive in the current status of Ontario's health regulatory system, but it will also incorporate, as the colleges are asked to, changing public expectations, as well as changes in the general best practice approach to performance measurement. And so once the updated standards, measures, and evidence are completed, colleges have been given the opportunity to provide feedback on those amendments. A refined or the second phase or second iteration of the CPMF report will be released, and the next CPMF reporting cycle will start. So that will be in October 2021. And the next cycle will look at the 2021 year. And so colleges, again, in this reporting cycle, will be asked to report back on improvements. So from the first report, if the college, as I discussed, committed to taking improvement activities or improvement actions, will be asked to provide an update or progress on those commitments that they made. They'll be asked to report. They'll ask to report any changes. I'm sorry, that was my son. Report on any changes in comparison to baseline reporting. And so what we're really trying to do is in the next reporting cycle, if nothing has really changed with regards to what you reported in the first cycle, you don't necessarily need to report and provide all of the same information again. What we're looking for is for colleges to report any changes from that baseline information that they provided. And then lastly, colleges will be asked to report on any of the refined standards, measures, and evidence. So where there were slight changes or tweaks or introduction of new information, colleges will be also asked to report on that. And so lastly, I just want to provide sort of an overview again on what that reporting cycle will look like. So starting where we look at a new cycle begins, colleges. So once that 2021 reporting cycle starts in October, colleges will look at starting collecting and analyzing the data needed to respond and fill out the report. Colleges again will engage with the ministry in discussions about the system partner domain. So what collaborative activities has the college engaged with, or with respect to other colleges and or other system partners. Next, the colleges will then go back, complete the reporting tool, post the completed CPMF report on their website. The ministry will review each of the reports and will provide performance feedback to colleges upon request. The ministry will repost their summary report, and again, there will be an iterative review of the CPMF to evaluate and refine the information reported to, again, make sure it continues to be relevant, necessary, useful. Okay, and it's envisioned that once the first cycle is completed, and this is sort of the process year over year that will occur. And so that ends the slides that I was going to speak to in detail. In the appendices, you can see there's information about the specifics around, what colleges are being asked to report on. So under the 15 standards, what is the information that colleges have to provide? And then in the next appendix, it looks at the actual measures under each of the domains. So it provides a little bit more granularity about the specific standards that colleges have to demonstrate. So at this time, I wanted to take a pause and allow for any questions, comments that the council has. I'm happy to stay and discuss any of those with you.
thank you for the presentation. Michael, do you want to go ahead and see if anybody wants to make any comments?
Sorry, can you hear me now?
I can hear you.
Okay. I have one question in regards to, will the ministry be doing audits of people's reports?
Sorry, Mike, I can't really hear your question.
Can you hear me now?
A little bit better.
Okay, I was just wondering, does the ministry plan on doing audits of the evidence supplied by the colleges to see if they're valid and properly reported?
So at this time, especially for the initial reporting cycles, what these are intended to do is to provide baseline information. So it's really collecting, what does the current landscape look like? You know, what are colleges doing? What processes and activities are colleges undertaking? The intent is not to assess colleges in any way until sort of that baseline information is established. And then that baseline information will be used to develop benchmarks. And so at this time, there won't be any assessment of what colleges have reported.
Okay, thank you. Does anybody else have any questions or comments?
Michael, if I may, please.
Yes.
First of all, Tara, I thought that was an excellent presentation. Thank you very much. I think that this CPMF has done more than I think the ministry would have anticipated in a very short time with colleges and what we're focused on. My question is regarding, you know, last year was a very tumultuous year, 2020. Big movement, anti-Black racism, anti-BIPOC racism, diversity, equity, and inclusion. And when I look through the standards and the domains, there's an impact on every single one of these domains. And of course, it's very important work that all organizations undertake and address. I'm just wondering if there's actually been any discussion at this point or consideration, or if the ministry might be looking at that in the future. I know that has been a discussion amongst the colleges.
So with respect to your question, as I noted, the CPMF is intended to be iterative year over year, looking at what type of information remains relevant. Is there information around changing public expectations that is relevant, that hasn't been addressed or hasn't been included? And so these are topics and questions that we will bring to the working group that will oversee the iterative review or the refinement of the first version of the CPMF, and will make recommendations for any changes that would occur to the second version, the second iteration of the CPMF. Okay,
thank you. As I said, I think it's awesome work. That wasn't a very professional word to use, but I do think it's wonderful. And I wanted to say to you again, thank you. You know, when we met with you in the fall or almost winter of 2020 regarding the system domain, partnership domain, and you made it very clear for us on how to proceed. So that was very much appreciated. And I think I'm really looking forward to more open conversations like that.
Yeah, no, it was a great opportunity for us as a ministry to hear about the work the colleges were doing, because I mean, we hear about, you know, some of this through council meetings and information that colleges provide, but there's a lot of activities and collaborations that the colleges undertake that, you know, without those meetings, we wouldn't necessarily be aware of. So it was very informative for us as well.